One of the recurring themes of this conference is political will. Governments need political will to tackle the problem. We may know what the answers are, but governments don't always have the political will, and nowhere is this more clearly demonstrated than in India. And my next guest, Dr. Sarit, is here to talk to us about the economic impact of tobacco. Dr. Sarit, welcome. Now, what's the economic effect of tobacco in India?
The recent study which we conducted, we examined the economic burden of tobacco attributable diseases, and we find out that the total economic burden is 1045 billion rupees, and if you compare it to some of the macro indicators, it is 1.16% of the GDP, and it is 12% more than the state and central government expenditure on healthcare. And also if you compare this with the revenue what government of India earns, this is just 17% of the total economic cost is earned from the excise revenue of the government. Therefore, these numbers are quite staggering and startling, and if you look into the male and female distribution of the economic burden, males bear disproportionately higher economic burden in comparison to female. And more than 91% of the economic burden is from the male, and this is a major impact on the people who are poor and who are economically downward. And in India, if you look into the pattern of tobacco use, it is the poor and socioeconomic backward class who are more likely to use tobacco, and the resulting economic burden will be more on the poor families.
So when you look at the economic burden, staggering as it is, how much of it is for direct costs, healthcare costs, and how much of it is indirect?
Yeah, the direct cost is only 16% of the total economic burden, and the indirect cost is 84%. If you know the direct medical cost, the direct cost is the cost which is borne by the individuals when they treat the diseases, but the indirect cost includes the cost for premature mortality and premature morbidity. That means it takes into account the loss of wage or the productivity which happens to the family. So a huge amount of cost occurs due to this productive loss, and it is entirely, if you look into that, it will be around 84%. It is a huge amount, and that productive loss in the economy is around 0.84% of the GDP.
So what needs to be done?
So there are 2-3 things which needs to be done. One thing is that though India has progressively made taxation on cigarette, it is increased taxation on cigarette, bidi, which is a country made item, that is not taxed, and we advocate for increasing taxation on bidi, and also the smokeless tobacco, which is consumed largely among the poor and the masses, and we should also see that how this there should be attempts to reduce the consumption of smokeless tobacco, which is available very cheaper price in the market, so that it is many poor people and students, youth, they also consume the smokeless tobacco. So there should be standardized taxation system in the country there, where we should not have a differential taxation, where bidi and cigarette both should be taxed equally.
Well, Dr. Sarit, thank you very much indeed for talking to us. We appreciate it.
Okay, thank you.